Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital. Welcome to Yale Cancer Answers with Dr. Anees Chagpar. Yale Cancer Answers features the latest information on cancer care by welcoming oncologists and specialists who are on the forefront of the battle to fight cancer. This week, it's a conversation about the role of physical therapy for patients in honor of National Cancer Survivors Day with Scott Capozza. Scott is a physical therapist for the Smilow Cancer Hospital Survivorship Clinic, and Dr. Chagpar is a professor of surgical oncology at the Yale School of Medicine.
So, Scott, maybe we can start off by you telling us a little bit more about yourself and what it is you do.
So I'm a physical therapist, and I am actually board certified in oncology physical therapy. So I've attained additional training to specifically work with people who have a history of cancer. So I work both in traditional outpatient physical therapy, seeing patients throughout their trajectory of cancer care, as well as I'm fully integrated into our Survivorship Clinic and also our new high-tech clinic at Smilow.
So tell us a little bit more about that in terms of how physical therapy really kind of enmeshes into the world of oncology. Many people may think about physical therapy and they think, oh yeah, that's what I do after I get my hip replacement or when I have a knee injury. Tell us a little bit more about how physical therapy really is very much intertwined with cancer and cancer treatments.
Yeah, actually, you had a great point there, Dr. Chagpar. If somebody was about to undergo a knee surgery, they would meet with the orthopedic surgeon, and then they would meet with the physical therapist for something called prehabilitation, because we want that patient to build up their quad strength, build up their hip strength, because we want that patient walking as soon as possible after that orthopedic surgery, and it's going to decrease the amount of time that patient is in the hospital, and it'll speed the recovery. So I'm starting to do this more and more with our patients, that I want to see them before they even have surgery. I want to be able to screen for any existing comorbidities that they might have, which might negatively affect how they recover from surgery. Plus, it also gives me as a physical therapist an opportunity to create a relationship both with that patient as well as our oncology team, so that they know that I'm a part of this team, part of that patient's team, that I can flow with that patient. I want to be able to see patients during active treatment. We know that patients can become fatigued during chemotherapy. They may still have post-operative pain. They may have limitations in range of motion. And so I want to be able to see them while they're actually in active treatment. And I will work around chemotherapy cycles. I will work around radiation schedules so that I can continue to see those patients while they're in active treatment. And then in the restorative phase, the survivorship phase, I want to be able to see those patients in the instance of any late effects that come up, anything that might affect their cardiopulmonary system, late effects from radiation or lingering fatigue or neuropathy. So I want to be a part of that patient's trajectory of care throughout their care.
Yeah. So you raise a good point, and something that I was going to get to, which is really this idea of, many people think that prehab, physical therapy, etc., is really more for people who are having surgery on their limbs. So maybe that makes sense for people who have a sarcoma or even a melanoma, where you might think, oh, they're going to have surgery on an arm or a leg, and you want to make sure that they're functional. But you've really outlined your scope to be bigger than that in terms of managing all kinds of patients with cancer, including those that may not have extremity cancers, but really that might benefit from, building up their stamina in terms of fatigue, etc.
Yeah, I'm seeing more and more patients who have a variety of different GI cancers, colorectal cancers, or pancreatic cancers. These patients may have already had neoadjuvant chemotherapy up front, and so they're deconditioned from that. Or again, they may have other comorbidities that are not necessarily related to their cancer, but they're just not going to be in the best possible physical condition to undergo a major abdominal surgery. So I want to be able to work with those patients and build up their abdominal strength, work on their cardiovascular fitness so that I can help them prepare them for that surgery to physically get ready. And Dr. Chagpar, I think one of the most important things that we as physical therapists can do in that prehab setting is to help our patients emotionally and mentally. I'm sure your patients have told you, and my patients have told me this, that during those initial days and weeks after a cancer diagnosis, a patient feels like they don't have any control over anything, right? All of a sudden they have all these appointments, they have to go for blood work, and they have to go for scans, and they don't feel like their life is their own. But I can give them some control back during that prehab phase by helping them teach them how to move their bodies and how to prepare themselves for what's coming next.
Yeah, that's such a good point. I think that many patients who may, get into physical activity might say, this is the one thing I can control. I might not be able to control the cancer. I may not be able to control the drugs, but I can control what I eat and I can control how I exercise. And that's my contribution to helping myself get better. But I also wonder whether, some patients might think, oh my gosh, this is yet another thing, another appointment that I have to manage. Have you heard that? Or how do patients really respond when you talk to them about prehab?
That's a great point, Dr. Chagpar. And yes, I do hear that when patients say, oh boy, this is going to be one more visit. This is going to be one more copay. And so I have that conversation with patients when I first meet them and say, what's going to work the best for you? Is it going to be that I see you at the hospital and try to coordinate my physical therapy visit when you also have a visit with your providers? Is it going to be over telehealth? Some folks will come from all four corners of the state, and so they don't necessarily want to drive 45 minutes one way for a 30-minute physical therapy appointment. So I'll say, listen, as long as you have a stable internet connection, we can do a telehealth visit. And I try to spin it, and I try to, try to have a little fun with it when I say, listen, it's an excuse for me that I got to work out too. If I have you pulled up on my laptop, I have to demonstrate the exercises so I get my workout in as well. So, but yes, ultimately, I want to make sure that I'm meeting that patient where they're at. So I will ask them, how can I help you feel better and physically get better for what's coming next?
Yeah. Scott, when we talk about cancer, many times we talk about obesity being a precursor or a risk factor for many cancers. And there may be patients who, are in that situation and they just haven't had the opportunity or the wherewithal or the energy to exercise. This may be something completely new to them. And they may also be a little disheartened about starting to kind of an exercise routine on top of perhaps even the guilt that they feel with getting a cancer diagnosis. Can you talk a little bit about how you can ease people into getting exercise in their daily activities as they're going through cancer?
Yeah, that's a really, really great point. And you're right. I always try to preface that by saying you didn't do anything wrong to cause your cancer. And you're right. For some people who exercise is not part of their normal routine, I need to know that. I want to have that conversation with them. And I don't overwhelm my patients with the American College of Sports Medicine exercise guidelines. Those guidelines say that they want anybody with a history of cancer to try to exercise 150 minutes a week. But that's a big number if you've never really exercised before. So I try to talk with them about how can we set up short-term goals and long-term goals, and to try to make exercise fit to their schedule. So, for example, I'll ask them, are you working right now? And what does your work schedule look like? If you're somebody who works from 7 to 3:30, you may not necessarily want to get up at 5 in the morning to try to exercise. So what we might talk about is saying, okay, you work 7 to 3:30, but then if you bring your exercise clothes with you to work and you change at work, and then you go to the gym on your way home, or you go to the track or the trail or something and you go for a walk then after work. That's a way that you can kind of sneak that in. You can kind of infuse that exercise into your day. Versus somebody who maybe works second shift. If somebody works 3 p.m. to 11 p.m., say, okay, well, you've got this time in the middle of the day. Maybe you work out, you try to go for a walk, or you try to do your exercises before you go to work. So understanding what that person's life looks like is so important, because I realize that exercise and rehab is only one component of all the different things that are going on for that patient at that particular time. So I will work with that patient and understand what their life is like, so that way I can make it work for them.
Yeah. And for some people, the gym is fabulous, right? I go to the gym. I love doing classes. That's really my thing. But for some people, just the concept of going to a gym is a little bit intimidating. And the idea that you have to go for a particular amount of time might be even more burdensome. But truthfully, as you said, I mean, exercise can be a walk, right? And that 150 minutes doesn't have to be 150 minutes in a block. You could maybe go for a walk in the morning for 10, 15 minutes and another walk in the evening for 10, 15 minutes. And before you know it, you have your 150 minutes.
Mm-hmm. That's true. I always try to break the ice there by admitting that I don't go to a gym either. And, then they look at me, they're like, you're a physical therapist, you should be going to the gym every day. And I say, no, I don't go to the gym. I've got 3 kids, so I don't have a whole lot of free time. So I have to do my workouts at home. So my bike is on the trainer in the basement. I do body weight exercises in the evening when they've gone to bed. So again, I try to make it as real for them as possible. So again, you're right. Some people love the gym, but other people don't want to go to the gym. And so that's why it's so important for me to have that conversation with them, to know what their preferences are, and then I can design that personalized program for them to help set them up for success.
Perfect. Well, we're going to learn a lot more about physical therapy and how it really integrates into the whole cancer journey, not just from the time that you're diagnosed and before your treatments start, but all the way through treatments and into survivorship. So please stay tuned as we take a brief break for a medical minute with my guest, Scott Capozza.
Funding for Yale Cancer Answers comes from Smilow Cancer Hospital, where their Survivorship Clinic is a resource for cancer survivors and provides patients and their families with information on cancer prevention, wellness, supportive services, and health research. SmilowCancerHospital.org. Breast cancer is one of the most common cancers in women. In Connecticut alone, approximately 3,500 women will be diagnosed with breast cancer this year. But there is hope thanks to earlier detection, non-invasive treatments, and the development of novel therapies to fight breast cancer. Women should schedule a baseline mammogram beginning at age 40 or earlier if they have risk factors associated with the disease. With screening, early detection, and a healthy lifestyle, breast cancer can be defeated. Clinical trials are currently underway at federally designated comprehensive cancer centers, such as Yale Cancer Center and at Smilow Cancer Hospital, to make innovative new treatments available to patients. Digital breast tomosynthesis, or 3D mammography, is also transforming breast cancer screening by significantly reducing unnecessary procedures while picking up more cancers. More information is available at yalecancercenter.org. You're listening to Connecticut Public Radio.
Welcome back to Yale Cancer Answers. This is Dr. Anish Chagpar, and I'm joined tonight by my guest, Scott Capozza. We're talking about his work with patients with cancer in honor of this being National Cancer Survivors Day. So, Scott, right before the break, we were talking about kind of this whole concept of prehab and the fact that for many cancer patients, really getting into exercise, meeting with a physical therapist, even before treatments begin, is often really helpful. Can you talk a little bit more about how people incorporate exercise even while they're going through treatments? I'm sure that there are some people who are listening right now who are thinking, my God, if I'm going through chemotherapy and I'm going through radiation, am I really going to want to feel like I want to exercise? Like, is that difficult? Can you talk a little bit about that?
Sure. And so one of the things that I need to know when I'm working with my patients is what is their chemotherapy cycle? Are they getting chemotherapy every 2 weeks? Are they getting chemotherapy every 3 weeks? Whatever that might be. Because what I talk to them about is how we can kind of dose the intensity of their exercise based on where they are in their chemotherapy cycle. So for example, let's say somebody gets chemotherapy on a Thursday. We know that they're probably going to end up feeling tired Friday, Saturday, Sunday. And so what I'll tell them is, if they can maybe go for a couple of short walks, again, and you talked about this in the first segment, Dr. Chagpar, where, if you break it up, if you just go for even a 5 or a 10-minute walk in the morning, and then maybe try to go for a 5 or 10-minute walk after lunch. And then if you can try to get one more 5 or 10-minute walk in the evening, well, that adds up to 30 minutes. So you don't have to think about trying to do the whole 30 minutes at once. That sounds like a lot. But if you can go for 5 minutes, 7 minutes, that's something. But then as you get further and further away from that infusion day, you start to get some of your energy back. And so that's when we want to start ramping up the intensity of the exercise. And that's when we want to start increasing how much more exercise we're doing. So especially for individuals who might be getting chemotherapy every 3 weeks, on that third week, they've pretty much recovered their energy. So I'm going to push those patients. I'm going to get them on the step machine, and we're going to do some light interval work. We're going to do some heavier lifting because that's a window of opportunity. So that's how I see it, Dr. Chagpar, is I look at where are the windows of opportunity to exercise. And again, it's so much of it is graded. It's graded based on where you are in your chemotherapy cycle. So that's chemotherapy. And then for radiation, what I will tell my patients is that with radiation, we see the fatigue sort of set on later on in radiation and even beyond. I think even first and foremost, to be able to educate them. Education is such a critical component to what we do as physical therapists. And to be able to educate them to say, you may wake up the day after you finish radiation and you feel great that you've finished radiation, but you may still feel tired because of that cumulative effect of radiation. So again, if you can get ahead of that, if you can get into a walking routine from day one and try to be consistent with that, you may stave off some of that fatigue. You may still get a little bit tired, but instead of the bottom kind of falling out, it's more of a lighter dip.
Yeah. It seems almost counterintuitive for some people that exercise can make you less tired. Because I know so many people say, I don't want to exercise. I'm already tired. Can you talk a little bit about that, kind of what on the surface may seem counterintuitive?
Yeah, and I acknowledge that. And again, I think validating those concerns, again, is a very important thing of what we all do as providers working with these patients. And so I say, yeah, I know that sounds counterintuitive that, oh, well, I'm tired, but, so the last thing I want to do is go exercise. But, if it's something where you say, well, just getting outside, get some fresh air, and then see if you can walk to the end of the block. Okay, great. You're able to walk to the end of the block. Can you go another block? And to be able to do it that way. And sometimes I will say, if you can go for a walk with a family member or a friend. Sometimes having that person to meet kind of helps with adherence, kind of helps with motivation, that sort of thing. So again, a lot of what I do is working with the person specifically and finding out how I can help motivate them to get them moving.
Yeah. But and I will just say to the people who are listening is that you really have to try it, because it's amazing. You go for a walk, or you go to the gym, or you do a Zumba class, and while you may have walked in really tired and not necessarily eager to be there, by the time it's over, you feel energized and full of energy, and it's really weird. Even though you would have expended all of this energy, you would think that you would be more tired, but I often am less tired
Yeah,
at the end of a good workout than I was to begin with. Or as one of my Zumba instructors says, I'm good tired as
good
opposed
tired. Yeah, I
to
like that.
being miserable tired. Um, Talk a little bit more about how we take what we've learned in this cancer journey with exercise and incorporating these good habits into the survivorship period. Because, you know, when we go through cancer, we go through treatments, and you may think that, okay, I have to exercise because this is part of my cancer treatment. But it actually is more than that. It's actually learning a good life skill that helps you in survivorship, not only to reduce your risk of recurrence or second primary cancers, but just for your overall good health. Can you talk about how we can sustain those good habits?
Yeah, that's we're at a point now, Dr. Chagpar, where we have the research that shows that being able to exercise on a consistent basis helps to reduce the recurrence of cancer. It helps prevent secondary cancers. So a lot of times I start there, is to say, we didn't have a lot of this research 20 years ago, but now we do. And so that's the evidence. And then from that, again, talking with that patient, meeting that patient where they're at, and again, identifying where are the opportunities for that patient to get exercise into their day. So again, they will finish treatment and they may return to work. They're returning to, being a caregiver, whatever it might be. So again, it's so important to understand what that patient's life looks like, because the last thing I want for them to do is to say, oh, I've got to block out 3 hours a day to be able to exercise. No, that's not what we're asking here. What we're asking is that if you can commit 20 to 30 minutes most days of the week, you're going to, yes, help prevent a recurrence of your cancer, but you're also going to be able to control your blood glucose. You're going to be able to control your blood pressure. You're going to be able to maintain a healthy weight. So all of these good things, it's global health. And when I work with dietitians and when I work with social workers, they hear this message coming from a variety of different providers. And so I think it helps to reinforce those lifestyle changes. That's really what we're trying to get at.
So, this is wonderful that you're able to offer these kinds of services and the support for cancer patients going through their journey all the way through to survivorship. But I wonder, for some of the people who are listening, and maybe they are going through a cancer journey or their loved ones are, does everyone have access to a physical therapist? And if not, what do they do? That's the first part of the question. And the second part of the question is, a lot of this, I think, is you really being there for your patients and kind of holding their hand through this journey. But once they're on the other side and they get into survivorship, they're kind of on their own in terms of maintaining those habits. Can you talk about the resources that people have, either if they don't have access to a physical therapist and are going through this cancer journey, and for people on the other side in survivorship?
Yeah. So the first part there is, how do they get access to a physical therapist as they go through their cancer care trajectory? They can start by asking their oncology providers to say, hey, is there somebody that you can refer me to? And if there is not somebody that's kind of local to them, again, telehealth is always an option. And if people are looking to other resources, maybe resources that are online, on social media channels and that sort of thing, what I would tell people is to make sure that you vet those sources. Make sure that those individuals that you're looking up on YouTube or Instagram or whatever, that they are certified in oncology physical therapy, or that they are lymphedema therapists, or that they've done the training, because the last thing you want to do is to get the incorrect information or information that could potentially harm you or hurt you. So be an educated consumer if you don't have immediate access to a physical therapist. There are some great resources that are out there, but make sure you do your homework and kind of vet them, so to speak. And then in the survivorship phase of things, again, I'm very fortunate that I get to work in this multidisciplinary survivorship clinic at Smilow with a dietitian and with a social worker and with a nurse practitioner to be able to provide that holistic care for patients. And I will make those determinations of, how's this person doing? Do they just need a couple of exercises that I can send to them over my chart? Is this somebody who does need more hands-on physical therapy? And if so, can I find somebody that lives close to them? Or if they do live close, can they come see me? Or there might be community resources that that I've been able to vet to say, I know that that there's a particular program or there's a particular gym where you live, or very close to where you live, that we've had other individuals go to, and they've had a lot of success with that. So a lot of it is finding those resources that are available to our patients wherever they might live, and to be able to connect them. Because I think that you're right. Our patients are looking for credible resources, and I think that we can be able to provide that information for them.
And Scott, I didn't want to end the show without hearing a little bit more about your story, your personal story that you recently wrote about. Can you tell us a little bit about that?
Sure. I am at this point now, I'm a 25-year cancer survivor myself. I was diagnosed with stage 2 testicular cancer when I was in my last year of grad school for physical therapy. And I do continue to have some late effects that I have to deal with. So I had this idea that I just wrote this down, and I was able to actually get it published, my story, basically talking about how those of us who are in late-term survivorship continue to live with late effects. And I just wanted to, again, validate all of the survivors that are out there listening, that those late effects are real, and that you should get the care that you need to address them.
Scott Capozza is a physical therapist for the Smilow Cancer Hospital Survivorship Clinic. If you have questions, the address is canceranswers@yale.edu, and past editions of the program are available in audio and written form at yalecancercenter.org. We hope you'll join us next time to learn more about the fight against cancer. Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital.